So if you had the ear of every policymaker in Northern Virginia, what's one change you would demand to make mental health care more equitable and effective for BIPOC communities?
Fund and have a pipeline for BIPOC therapists. Our young people, our young adults need to see themselves when they go to the doctor, which means they need to see doctors that look like them, which means they need to have funding and pipelines at their schools. We also have to believe lived experience. Also, it's making sure that, as we said earlier, that these programs are funded, that it is an open conversation, that we remove the stigma from talking about mental health.
I would say investing in more certified community behavioral health clinics and having more, thinking about language, like what I mentioned earlier, thinking about language access when you're thinking about funding for mental health. Because again, if we're not able to understand, then it makes it already, it's not going to be helpful, especially if you're talking about for that those specific communities that need it.
Earlier, I spoke about how there's lack of financial resources to seek mental health services. A lot of people are uninsured or their insurance coverage is not enough. So if I had the ear of every policymaker in Northern Virginia, I would advocate for increased coverage for Medicaid and private insurance for mental health services, as well as increased sliding scales, more mental health practices to use sliding scale for those individuals that have no insurance.
Kind of like what we mentioned already too, I feel like another big thing is the accessibility. I think it's important that we meet our clients and our families where they're at. I feel like it doesn't just have to be a doctor's office or virtual. I like how you mentioned like maybe in the schools, maybe at church, faith is important to a lot of communities, and just like going to them instead of having them find us all the time.
Yeah, I would like to mention the education at school, like not only for the students but also for the teachers. A lot of like young folks spend a lot of time with their like teachers. But what if like teachers are not well educated on what's to understand what's trauma-informed care? It can be kind of like another barrier for students to be empowered on mental health. So I would like to emphasize on the education for the teachers as well.